What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. Welcome to Anatomy Practical Exam Question Series. We have a question here, and today you asked about two unrelated structures, two different structures which are not related. Unlike the previous sessions where we've seen the first part of the question is asking about structure P, and the second part is asking something in relation to structure P, maybe origin, insertion, innervation, action, or sometimes branches or even clinical correlates. But today we'll see we have two different structures which are not related, and the first part of the question is asking you to identify structure P, and the second part can be different, can be completely different, like asking you to about the structure J, maybe for example naming the structure J, and the second part of this second part is asking the terminal branches of the structure J. So this is very important to notice, because for this kind of tradition, the answers in part A will not affect the answers in part B. For example, if you fail to identify the structure P, you're not going to affect the second part of the question. And the second part of the question does not depend on the first part in this scenario, in this particular situation. For example, for structure B, if you fail to name the structure J, if you fail to name the structure J, you automatically got this wrong. If you fail the first part, you automatically fail the second part. But A and B are not related, because P is a different structure and J is a different structure. But something relating to J, if you fail the first part of the question, you automatically got wrong the second part of the question. This is why you have to be very careful. Alright, so what's the structure P? Structure P is looping. You see we have a branch here, a nerve which is looping around the aortic arch on the left side. So what is it? That should be the left vagus nerve. That is the left vagus nerve, and I told you, you have to be specific about the side. Be specific as much as possible. Structure B is the left vagus nerve, and then we are going to structure J and name the structure J. What is structure J? Pay much attention here. It's coming from this branch over here. So it's coming from the subclavian artery, the first part of the subclavian artery descending down. That will be the internal mammary artery or the internal thoracic artery. But on which side? Be specific again. That's the right internal thoracic artery or right internal mammary artery. That these are true. And the second part of the question is asking about the terminal branches of the internal thoracic artery or the internal mammary artery. So what are they? What are the terminal branches? We have the musculophrenic artery and the superior epigastric artery. You might specify right musculophrenic artery or right superior epigastric artery, but to this part is not very important as this one. This naming, you have to be specific, but the terminal branches you may or may not. But it's far better being specific, because you never know what the examiner wants in that particular exam. Assume you say this artery is an axillary artery, for example, so you automatically get wrong. Even if you say the musculophrenic artery and the superior epigastric, it doesn't match what you have said, because the musculophrenic artery and the superior epigastric, they are not branches of the axillary artery. And even if you said branches of the axillary artery like superior thoracic artery and the lateral thoracic whatever, you automatically get wrong, because this is not the axillary artery. So see, this is very, very important to pay much attention here. Stay tuned, more to come.